Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will introduce you to several area experts who have developed health-related programs of great value to all of us. In our first segment, we will meet two nurses from Fremont-Rideout Home Care who will inform us about the hospice services that are readily available in our community. Hospice is an important service that assists people of all ages dealing with the issue of terminal illness. Our second segment this evening will focus on the continually important subject of AIDS and AIDS education in our community. Is there an epidemic of AIDS in the Yuba Sutter area? Well, stay with us tonight for our program and you'll find out. In the Pharmacy Corner, our award-winning neighborhood pharmacist will teach us about a medical condition that eventually affects the urinary system of almost all men during their adult years. Tonight, our expert pharmacist will update us about benign prostatic hypertrophy and new methods of non-surgical treatment using medications. Tonight's program will be extremely timely and very informative and important, and I hope that you'll stay with us for the next half hour. It's now time for us to visit our Pharmacy Corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in our Pharmacy Corner is, of course, our award-winning pharmacist, Bob Church, from the Medicine Shop Pharmacy in Marysville. Bob, welcome back.
Thank you.
Great to have you here.
Thanks a lot.
Tell us about the condition of benign prostatic hypertrophy.
Well, it's probably, or is, the most prevalent voiding dysfunction in men, and it's certainly linked to age. It's characterized by enlargement of the prostate gland, and because the prostate gland surrounds the urethra in the male, you have a constriction of the urethra, and so then you have urinary symptoms such as urinary hesitancy, frequency, difficult urination, and weak stream. This is almost always seen in men over the age of 50 years of age.
What causes it?
Well, it's basically caused by, actually, there's only two factors that cause it. It's aging and adequate testosterone levels, and that's why almost all men get it. As we get older, as the testosterone converts to dihydrotestosterone, it creates bioprotein synthesis in the prostate gland, which increases cell growth and tissue, and your prostate gland grows. And
interesting.
When that happens, if you get the constriction of the urethra, then you get the urinary symptoms.
What drugs are used to treat it?
Basically, there's two categories of drugs. One is the alpha-adrenergic blockers, which people would know as Minipress, Hytrin, Cardura.
So blood pressure drugs and
right.
heart
These were drugs that were actually utilized to control blood pressure, and now we use them more to control urinary symptoms in BPH because they relax the smooth muscle around the bladder neck and in the prostate, and therefore the symptoms decrease.
What about the other class?
The other one is a drug called finasteride or Proscar, which actually inhibits the enzyme that converts testosterone to dihydrotestosterone, which, as I said before, is the thing that increases the size of the prostate gland. So by inhibiting the enzyme, you have decreased levels of dihydrotestosterone, and the size of the gland will diminish, maybe as much as 30% over maybe a year or 2 years' time.
Interesting. Tell us about side effects of these drugs.
Side effects of the drugs such as Hytrin are basically blood pressure involved. Because they are blood pressure drugs, initially they do affect receptors in the blood vessels, and they cause relaxation of the blood vessels and a drop in blood pressure. Usually 10 to 15% of men will have some blood pressure problem with those drugs. You have a problem as you get up from a laying or sitting position. You have to titrate those drugs up as far as dose, because the dose that handles BPH is higher than the dose that you would normally use to control blood pressure.
How about Proscar?
Proscar is actually a very, from the standpoint of side effects, maybe 5% of men will have decreased libido, maybe some impotence, but as far as that drug, that's usually it as far as side effects.
Any new drugs on the horizon?
There's a new drug called tamulocin or Flomax, which is like the drugs like Hytrin, Cardura, except it is very specific for the receptor sites in the bladder, neck, and the prostate, and not so much the blood vessels. So you don't have to titrate the drug up. You can start at maximum dose. You have very little blood pressure involvement. In fact, actually, this drug might be good for people who need the BPH treatment but also have blood pressure problems too. And very few side effects.
Is it on the market now?
It is on the market. It's relatively new in this country. It's been used in other countries for a long time.
Any doctor can prescribe it, though.
Absolutely.
Great. Bob, as usual, that was very useful information. I hope our viewers will discuss their concerns about the prostate with their pharmacists and physicians when they have their next opportunity. We look forward to you returning to the Pharmacy Corner on our next program.
Thank you.
Thank you very much.
You bet.
The subject of the terminally ill is often one that is rarely discussed. However, it is a stage of life that most of us will experience, and we're fortunate tonight to have two experts from Fremont-Rideout Home Care to let us know about their hospice program. I'd like to welcome Nurse Lynn Taylor, Director of Home Care Development and Education, who's returning to our program, and Nurse Evelyn Barnhart, Hospice Coordinator. Welcome. Thank you very much for being here. Did I pronounce the names correctly? Everything? Good, great. Why don't you begin by telling us, Lynn, exactly what hospice is?
Well, hospice is a special way of caring for people that have a terminal illness and their families, and that's a real important thing to remember about the unit that we're taking care of. Hospice strives to meet the patient's needs, both emotional, physical, and spiritual needs. It's not a real brand new idea. Hospice used to be a respite or a place of rest for weary travelers hundreds and hundreds of years ago. And now we kind of look at it as a place where people can find comfort and support for the end of the life's journey, which is their end of their life.
It's true. I picked up Webster's Dictionary last night and looked up hospice, and there were the two definitions, the one about a place to stay when traveling for help, and the other, what we're talking about today. That is sort of interesting that way. Why is it so important?
Well, it's really special because we offer a lot of benefits that aren't offered in traditional health care. Through hospice, it allows the family to be involved in decision-making for a loved one in the home. It also allows the person to decide where and when and how they want to be at the end of the life.
Evelyn, what makes it so special, though? Tell me about that.
I think one of the things that makes it so special is because we treat the whole family as a unit of care, not just the patient. So we are just as concerned about the family's physical well-being and emotional well-being as the patient's.
Who are the members of your team?
Well, we have a medical director who's Dr. Coulter at Rideout Hospital, and he provides medical advice and consultation for us. We have
Does he actually go out to the houses and meet people?
No, he mostly does it as a consulting during our team meetings.
Oh, I see.
He attends those.
Conferences between everyone in the group.
Right. And if a physician is not available, he will step in and help out in that case.
Also,
which
an
is
example
very
might be
nice.
if someone in the community doesn't have a physician to help, they could call you and you could work with Dr. Coulter to help coordinate that.
We could help coordinate that.
That's
yes.
great. Great. So a doctor doesn't have to make the referral to do that?
We need to operate with a doctor's order.
Okay.
So a patient does need to have their own physician.
Okay.
A lot of time there's a thought that once they sign on to hospice, they are no longer connected with their physician. But that's not the case. A physician actually is a part of the team also.
Could you give me an example of a case, a hospice sort of case, just to make our viewers understand, like a type of disease or type of age? I'm curious about that.
There's no age requirements or limits. There's actually no disease limits either. At the terminal stage, the end stage of any type of disease where a person has 6 months or less to live would be appropriate for our care.
I see.
So it could be anything.
Great. Where is it provided, this care? Is it at the home?
Most of our care is provided in the home. We do also work with some of the long-term facilities where a person has been there for a while, and that is considered their residence at that time.
So what people would consider nursing homes or extended
Correct.
care, so things, they have other names around community too, but that's what you're talking about. Great.
Mostly in the home, though.
Home, great. Lynn, who pays for these hospice services?
Hospice is paid for by Medicare, Medicaid or Medi-Cal, and private insurance. Private insurances are really starting to realize the benefits of hospice, so there are more and more private insurances that are covering these things. I think it's important to know that there is no cost to the patient for hospice services. We provide those services. We're able to provide those services through contributions from the community, through the Fremont-Rideout Foundation, and we have a lot of volunteers that work with us too, so we're able to provide those services free to the patient.
So your home care organization, Fremont-Rideout, will help with the insurance information checkups and the authorizations and all of those things, and if referrals, other referrals are necessary, and that whole work. Great, because patients can really get into trouble.
We don't accept them on their financial, we accept them on their health needs.
How can our viewers take advantage of these services?
Well, basically, anybody can call and ask about these services. They usually are referred by a physician or the hospital discharge planning, but anyone can really refer and ask for the services. Then we try to coordinate that care with the physician. So, you know, if anybody wants further information, they can call our office and try to find that out.
Let's talk about some actual case studies that you might be involved with. Someone that may have Alzheimer's disease doesn't really qualify to just get right into hospice because they can go on for a decade with that disease or more. Let's say someone did have that disease. At what point would they be into the hospice program? Would they have to have some other diagnosis or just be sort of deteriorating, or how would that be?
They would not need to have another diagnosis. There are some other criteria we go by: weight loss, ability to function, increased weakness, poor endurance, those type of things, general wasting, and to where the physician really feels that their decline probably has given them 6 months or less to live.
In a few moments we're going to be talking about AIDS in the community. Would an AIDS patient in their last stages be appropriate for
Yes,
this
they would. Yes, they would.
And there's no problem with that disease. You'll be happy to serve them just like everybody else.
Absolutely.
Great. Lynn, would you like to update us briefly on other home care things happening that we should just refresh the viewers' memory about?
Well, you know, basically, again, home care, we have our home health, we have our hospice, we have home infusion and home medical equipment. We have a lot of different services for home. I think with health care, where it's going today is that there's being more and more services provided to people in their home, and they're being able to make decisions about where they want to be. And I think that's really important right now.
Absolutely. I really like what you do with the Fremont-Rideout Home Care, and thanks for joining us tonight. Nurse Lynn Taylor and Nurse Evelyn Barnhart, thank you very much for being here.
Thank you.
Thank you.
Welcome.